Hello, I would like to introduce Kirti and her family who have come all the way from Malaysia. Kirti is a 14-year-old girl and she has a lumbar scoliosis, what we call in medical terminology as a Lenke type 5 curve. It measures around 40 degrees and she is perhaps the first child from Malaysia to undergo anterior scoliosis correction. I will let them introduce themselves and talk about their experience and how they came to Apollo Chennai for treatment.
Hi, my name is Kirti and these are my parents. I came here to do a non-fusion scoliosis surgery in Apollo Hospital.
Yeah, well, to start off with, my daughter Kirti, a year back, she was kind of tilting towards a side and it got gradually increased. So we decided to go and look at an orthopedic to get an consultation from the orthopedic to see what was wrong with her and the deformation. And they suggested to go in for an x-ray. We got an x-ray done and then they said that this is scoliosis. That's when we got to know about the term scoliosis as a deformation, and they suggested that we have to go in for a surgery. And after that, we consulted a few more surgeons and they also given the same kind of opinion. But the thought that they had was she had a curve of 30 degrees, and then they said that we had to go wait until the deformation becomes bad and then we do the surgery. But we weren't quite happy with that, so we decided to go and do some more research on this and see who would be the best person that we could go and meet the next to get some information. And when we started to do our research on scoliosis, we bumped into a few of the videos by Dr. Hegde, which was very clearly specified in terms of what is the kind of technology that he uses to do the surgery. And we did see a few testimonials that he had of a few children of her age who had scoliosis, and what were the kind of improvement that they had after the surgery that actually caught us attention. And we did further research in terms of where does Dr. Hegde practice and what are the ways in which we can contact him and get an appointment to go and see my daughter. So that's when we decided and we got information that he is working in Chennai Apollo. So we made an appointment to come and see him. And thankfully he was around because we were here in India for 3 days to get some consultation from some of the doctors. And we managed to get a slot and we did talk to Dr. Hegde, and we were happy to hear the consultation from him where he described what is the deformation about and what are the ways in which we can get a treatment and the correction made. So that was in the first week of July, and he did show in some of the videos of some of the patients that he had to as a testimonial to see what it was before and what is the correction that he did and how the children could have mobility and flexibility. That was a major concern that we had because the few surgeons that we saw earlier were more into doing the correction as a fusion type, and then it was they would have rods behind their spine and they will lose their flexibility and mobility. So that was very alarming for us, and we didn't want to go ahead and do a correction that would be a hindrance for her mobility and flexibility. And after we saw Dr. Hegde, who gave in a description of the kind of non-fusion type of surgery which he is going to go and do, and which would give her the flexibility and mobility. And after the consultation, we were happy to hear whatever description and explanation that he had given. And then we went back, and after a few discussions that we had within our family members to see whether we want to go ahead for the surgery or wait for it, And then we decided, instead of waiting for it to really get bad and do it, might as well do it earlier so the correction will be better. And the other thing that we were very impressed when we saw Dr. Hegde in the beginning during the consultation was he asked us to go and get this x-ray where he stretched and got an x-ray done. And he said that the result after the correction that I do for her would look very much similar to this. And that was really, really very satisfying. So we decided that if at all we had to do it, whether now or maybe a month or two later, it would definitely be with Dr. Hegde, because he could tell us that this is how the result is going to be, and that was very, very satisfactory. And after a few weeks, I should say,
3 weeks.
yeah, about 3 weeks, we decided to go ahead and get the surgery done. And then we emailed Dr. Hegde to say if it is possible for him to give us a slot for the surgery. And well, thankfully he did agree, and he said that he can accommodate us by the end of July. And we made all the necessary arrangements, and he did from his side as well. And then we flew here on the 18th of July to get some pre-tests done, and then we got the surgery done. And here she is after a week surgery, where she is able to sit down the third day and walk on the fourth day by a little bit of support. That itself is very satisfactory, and we're very thankful.
To add on to this, I would like to thank Dr. Hegde and his team, Dr. Vignesh and the team, to really make things to happen.
Thank you very much.
Thank you very much.